Morning, everybody. Time is less and clock is ticking. And this clock really scares me. I cut down my slides to 50% and I found that rather than showing you all theoretical parts, I'll demonstrate to you something live. સૌ પહેલાં તો પ્રજ્ઞેશભાઈએ કહ્યું હતું કે ડબ્બાના ઢાંકણા ખુલ્લા રાખજો. મારું એવું માનવું છે કે જેના ઢાંકણા ખુલ્લા છે એ જ અહીંયા છે. હા, ડબ્બા ઘેર રહી ગયા. મસ્તી પછી કરીશું, 1 મિનિટ જતી રહી એમાં. In day-to-day practice, you must have realized that patient keeps on calling us for a number of times in a day to understand what is the situation of a patient. And not only patient, એના કાકા મામા પડોશી સાસુ સાસુની બહેનપણી બધા પૂછે કે કેવું છે અને એના કરંટ ડેટાના જવાબ આપવાના આવે આપણે. In that circumstances, it becomes very difficult when somebody is admitted or somebody is remotely stationed patient and you have to give a statement on the status of the health. For a doctor, it becomes really a cumbersome situation. I always like to be known as a doctor than a technocrat, and I had been having a great hobby on electronics and IT. So behind the curtain, I had been doing plenty of experiments, and I never liked medical community to know that what I have been doing. But since last 2-3 years, I have understood that in coming decade, the practice is not going to remain same the way we are practicing. It is going to be all the way different. I see the days after a year, after launch of 4G, patient may ask for a teleconsultation on his mobile, and we have to attend that. Even Government of India is also taking great initiative to make the country digital India, and healthcare is the prime address at present for the technology department of India. So I see that doctors would have to understand the value of incorporation of technology into the practice, updation of the knowledge, communication skill with the patient, because ultimately patient's experience, patient's satisfaction would come only when we give them correct information. And to give that correct information, we must have correct information. Then only we will be able to pass on. So today I'm going to speak about how to gather live data remotely. Long ago, what did we do at concert? People danced at concert. And what do they do now? Now they click, shoot, share, and WhatsApp. Rather than dancing in the concert, they are busy on selfies. So this is a transformation because of the different availability of the technology. Now it's healthcare's turns to get transformed. It is our turn. And so far, in my experience, we have not been accepting technology because any technology which adds the cost to the practice, which takes more time out of attending one patient, is never going to be acceptable to the medical community. But now, as Dr. Sankla said, that most of the apps are free, so it doesn't add the cost to the practice, and it saves a lot of time also. So now medical community will be more overwhelmingly accepting the technology. Mobile and internet, that has become the fabric of part of our life. And no doctor would have spent a day without being on phone for more than an hour. Everybody works and uses mobile and internet. And that is how a simple mobile smartphone can transform our practice. For remote monitoring of a patient, what you need naturally a patient. Then plenty of monitoring devices, then telemonitoring interface, a server, and yourself. These are the 5 important components of remote monitoring of the patient. Where can be a patient? Where do you think that patient can be for remote monitoring? Patient can be in ICCU and you may be at Mount Abu, you can remotely monitor that patient. Patient can be in operation theater, an attending physician or attending cardiologist may be somewhere in other hospital and still he may be monitoring that patient. Patient may be outdoor, he may be mobile, he may be running, playing football, playing cricket, and still that patient can be monitored. Or patient can be at home, maybe chronically sick, and that can be monitored. Specialist and location, where do doctors stay in this situation? Doctors can be at the central station of ICCU, doctor can be at a remote monitoring station. You will find in very near future number of monitoring stations. Few of the doctors sit in one room, one center, and they monitor number of the patient all over the state or a country. Even doctor can monitor that patient. Patient may be anywhere, doctor may be anywhere, and doctor can monitor one patient on his mobile device like tablet or a smartphone. Or a specialist can select number of patient on one device. Patient can be in different hospital and he can select those patients and can monitor on one screen. And different modalities can be monitored. Pulse, BP, temperature, SpO2, EtCO2, every parameter can be monitored. What are the parameters available for remote monitoring? You can monitor the diet plan, you can monitor the physical activity of the patient, you can monitor the medication, monitor the symptoms, monitor the vital parameter, monitor the chemistry, you can monitor different waveforms like ECG, EEG, EMG, you can live monitor remotely, and you can monitor images. You can set up disease-specific monitor. You can monitor plenty of parameters of a diabetic patient. One patient, multiple parameters, like cardiac, hypertension, respiratory, even psychiatric and pregnancy also can be monitored. For diabetes, you can improve the compliance through interactive app with the patient. You can monitor different type of biochemistry. You can monitor live ABPM and fundus and ECG. In cardiac, you can have live Holter monitoring, live ABPM, treadmill, echocardio, everything can be made live and remotely monitored. What are the technologies and devices and services available? For personal monitoring, there are home care appliances, number of, as Dr. Rohan demonstrated, number of home care appliances are available, wearable devices are available, smart clothings are available, and implantable devices are available. Institutional, large number of gadgets, I will just show you some of the pictures. Mobile apps, Dr. Sankla has already discussed. These are different type of wearable devices that patient can wear and can keep on moving, and treating doctor or an observing center can have monitoring on different parameters. These are the smart clothings one Israeli company has manufactured that a patient wears, plenty of parameters can be monitored on doctor's mobile. These are wireless implantable medical devices, and continuous glucose monitoring is the hot equipment nowadays. The diabetic patient can be implanted with monitoring system, and treating diabetologists can observe that fluctuation in the sugar remotely and can guide the patient. What are the advantages? It opens the line of communication with the patient. Since patient is directly live monitored, if a doctor calls the patient that your ECG is uneven and your heart rate has increased, do you have breathlessness? Then patient feels so good that somebody is really monitoring. Bhagwan dekh raha hai. Every time patient don't have to rush to a doctor for a small complaint. That complaint may be large complaint, large problem for the family, but doctor knows that it is not that grievous problem. So you can reduce the travel and travel time. This prevents unnecessary hospitalization also. Disadvantage to us. and definitely it improves the patient care. Now, I say this hall is full of doctors, and if everybody tries to see the live demonstration on your mobile, it may hang up the local network, but let us try that. Just open up your browser. I request the audience, open up your browser, write medicodb.com, username is DNV, and password is hitcon. Yeah. टू जी पर पण चालશે નેટવર્ક હશે તો ચાલશે થોડું ધીમું આવશે પણ ચાલશે ખરું યુઝર નેમ ઇઝ DNV પાસવર્ડ ઇઝ hitcon and just sign in. So there is a patient demo hitcon. Just touch demo hitcon.
How many users can at a time get onto the site?
More than number of the doctors present in this hall. So no worry, server doesn't get hanged up. The question may be the availability of bandwidth of internet. So this is, on your mobile, you will see the ECG like this. So this is remote monitoring of ECG. You will see the ECG like this. And this is a normal ECG. So I really don't have to write anything. I will just select the template, normal ECG, and it writes everything for me. I really don't have to write. So this writes no significant abnormality detected, and this ECG is found to be within normal limit. As Pragnesh Bhai told that there may be some trouble, I am facing it. And I approved the report. So now it is ready for the printing.
Okay, input for this ECG is from your express machine?
From any machine. You can upload by WhatsApp also. Your own machine can be integrated. Let us stick to theoretical part only. And report is ready for the printing. Could anybody open? I can demonstrate such number of live monitoring, but time doesn't permit, and internet is not good bandwidth here. So if there is any question. Thank you.